Hey there, and welcome to In Sickness and in Health's first bonus episode. This podcast is about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Cara Gale. I'm not a doctor or a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. Nothing said on this show should ever be considered medical advice. If you're experiencing a medical issue, please seek qualified medical help. I know the system sucks, but I do wish you a lot of luck. Every person is different, even within disease groups, so none of my guests should ever be regarded as official representatives or spokespersons for their conditions. Please respect their very personal choices, and unless they ask for it, please don't make suggestions about treatments or lifestyle changes. Unsolicited medical advice is almost never not annoying. This is a bonus episode to accompany episode 16 with Abby Norman. This is the backstory of her endometriosis, and she tells the story of its onset and her first surgery. You can learn more about endometriosis from the links in the show notes and in episode 16.
When I was a sophomore at Sarah Lawrence College, which is in Bronxville, New York, I was 19 going on 20. And I was living on campus with my roommate / total best friend. We're still very close. And we were living in a little house on campus, which is, Sarah Lawrence had a really interesting setup for that. So my first year I lived in an apartment building and I had like 6 roommates. And so my second year, Rebecca and I were sharing a room in a house that was like a co-living situation. So basically, I got up one morning and I got in the shower, and it kind of went down in history as like the worst shower I've ever taken in my life, which is kind of how I always start the story to people, because it was such a stark beginning point. And I don't know if everybody has that, but for me, it's like that. There really was a singular moment when my life before and my life after was marked, and this is it. You know, and I remember I was in the shower, and it was just that I got this very like severe lower abdominal pelvic pain. At first, it was a little vague, but it was very well situated, sort of more to the right side, and it was consuming. I mean, and I was a dancer, so I was very used to pain, all kinds of pain. I'd torn up all my muscles and, just knew how to like press through feeling like shit. Like that was something I was pretty well acquainted with. This was very different. And the pain got worse, and I was standing in the shower and I started to get really nauseated. And, I thought, is this going to be like a period related thing, or do I have food poisoning, and I just remember that there was a moment where I didn't necessarily like faint, but I definitely the pain was so bad that I was sort of losing my focus on what I was doing. And you get in a shower and it's very humid, and you get a little disoriented from that anyway, so I like stepped out and was on the floor. And I remember there was a guy who lived down the hall, and he would just like randomly play his bongo drums all the time.
Oh, college.
Yeah, right? So you have to imagine, like, here I am, I'm on the bathroom floor, and I don't even know I'm like, I don't know what to do. I'm like, do I call for help? Like, what's wrong with me? Am I bleeding? And then in the background of all of this is this guy playing his bongos at like 7 in the morning. So it was such a bizarre, like, experience. And I finally did manage to like get myself up off the floor, and I like crawled back to my room, and my roommate was still asleep. And it hadn't necessarily like nothing had like exploded, you know what I mean? Like I wasn't exploding, I wasn't like bleeding. So I thought, well, I guess I should just go to class, because I mean, I don't know, do I go to the hospital? Do I go to the health center? And for me, I think there was a period of denial in the first few days of this mysterious sickness, because to go back a little bit, I had gotten emancipated when I was 16. So the fact that I was at this school was completely contingent upon the scholarship I had academically. So I didn't have, it didn't have like the nuclear family support. I didn't have the financial support. The fact that I was at this school in the first place was, you know, I was there because they'd given me the money to be there.
And Sarah Lawrence is like consistently on towards the top of the list of like the most expensive private colleges in the United States.
Yeah, when I was there, it was $60,000 a year.
Yeah,
if you can even wrap your head around that.
Yeah.
It was unbelievable, and I was really, really lucky to, you know, be in a situation where they could offer me enough assistance to be there. And that being said, like, I definitely had gone through a few years of having some pretty extreme, like, you know, fiscal struggles, just trying to work, you know, a ton when I was in high school and save money. And, you know, I still got really good grades, and, you know, I was trying to juggle everything. And so for me, going to Sarah Lawrence in the first place was, you know, I didn't have any incentives to stay here. You know, I had like my best friend from school who I still love. And, you know, I was very close to her, and I'm still very close to her. But other than that, like, I didn't have anything keeping me here. So I wanted to go to New York and start over. Nobody would know anything about me. You know, I could just have my life. And, you know, so I at this point when I got sick, Sarah Lawrence had really become home for me. Mm-hmm. I loved my professors. I had a couple of really, really valuable mentors. I had friends. I had a sense of community. So the prospect of losing that was not something I was willing to confront. Certainly, it never occurred to me to, like, not go to class in those first few days because I couldn't afford to have my GPA go down. I couldn't afford to, you know, anything that might screw up my chance of being there was like, you know, that was my ultimate motivation. So there were a few days where I sort of was in this haze. And it's funny because there are pictures on Facebook of me from that week. And it's so bizarre because I can look at them and just see how sick I was. And I was still trying to, you know, haul myself to my lectures and walk across campus. And, you know, it wasn't until I think probably, it must have been like a Friday night of that week. And, you know, I finally got to the point where I thought, yeah, I've got to go to the hospital. And I actually thought maybe I had appendicitis. And it had just gone unchecked because by then the pain had become really, I mean, the pain had stayed very consistent, but it was so, like, right-sided, you know what I mean? Like, mm-hmm. I felt it all the way in my back as well at that point. And I also just had a feeling of, it was like a pressure. It was really bizarre. It was like, and I've never had anything else ever feel that way. But it was almost like, I don't know, a very tangible sense of something that wanted to rupture, and mm-hmm. Like reach in and pull it out. It was like, and I kept thinking, I remember I was in the emergency room waiting to be seen, and I kept kind of like subconsciously like touching that, like my hip, and just being like, you know, oh God, I just want to pull it out. Like whatever it is, I just want to pull it out. And it was almost like a crazy visceral, like, it almost made me feel like I was losing my mind because I was like looking around and I was like, I will jab something into my body to relieve this because it's just a bizarre, uncomfortable feeling. But it also felt really scary. Like it felt like, you know, if they don't figure this out, maybe something is going to rupture, or maybe maybe there's something poison in there. Like what, you know, it just felt like primally not right. Like I felt very threatened. And, you know, I'd had injuries and, you know, I knew how to sort of articulate my pain, I think. And I think that's one thing that people who dance or do something very physical, they learn a lot about how their body works, and mm-hmm. they get very good at articulating, you know, where the pain or the injury is. They know their muscle groups, they understand their joints. And so I thought I was doing a pretty adequate job of describing it in the emergency room. But then again, I was also really sick. I was running a temperature, so I probably wasn't doing as great of a job as I thought I was. But in any case, the short story is, the first time I was in the emergency room, he said, you know, the guy said, you probably have a UTI. Here's some Cipro. You'll be fine.
What kind of tests did they run? Did they check you for appendicitis?
Well, here's the cool thing. I mean, cool, and I mean this in a terrible way, but cool as in, like, this is just a prime example of the multitude of things that are wrong in healthcare, right, where, you know, the other hand doesn't know what one hand is doing. So they did do a CT scan and blood work and a urine test. And I never saw any of those records until after I had already left school and had to come home. And at which point they started billing me for things, and I had enough awareness to say, well, I want an itemized statement, but I also want my records. When I got the records, and this was, I don't know, at this point, months after that, I saw that he'd never said anything about my appendix other than I had said, do you think it's appendicitis? And he said no. On the CT scan, it actually had shown, and the radiologist had said, you should correlate these results with the clinical presentation because there is the beginnings of some inflammation at the base of the appendix. And I have no idea why he didn't take the rest of my symptoms, which were not necessarily traditional appendicitis symptoms, but certainly wouldn't be, completely out of the realm of possibility. I don't know what his clinical thinking was like, but once I found that and discovered that, it made me a lot more aware of needing to advocate for myself and to understand what the whole clinical picture was.
Right.
And that being said, of course, it became a much more complicated issue, but I came home. Eventually, I had gone to the emergency room several times. It was always, probably a UTI, or you need to have a gynecological examination because you could have cysts, which was actually a pretty good
good guess.
Yeah, that's a pretty good guess, honestly, considering that they were so far from right initially, and I got to the point where I was so sick at that point. I had been in and out of the hospital for 2 weeks, and the dean of students said, you have to go home. And I said, well, I am home. Like, where am I going to go? Like, I came here, and I had been living in people's houses that were just nice enough to give me a couch to sleep on for like 3.5 years. I didn't know where the hell I was going to go. And being that sick, I was like, if I'm alone and something happens to me, like,
terrifying.
It's terrifying. And I just felt so awful that I kind of wanted somebody to be around, and so I did come back, and I had a multitude of friends that I reconnected with and was sleeping on people's couches and trying to get to the bottom of everything. And I left school in October, and I had my first surgery in December. And I'd come home and connected with a gynecologist who was affiliated with like the physician practices that I'd seen as a child and as growing up here. So, the local medical staff and everything. And she agreed to do a exploratory laparoscopy.
And I'm just going to point this out for the listeners here. That is the only way to definitively diagnose endometriosis. And yes, it comes down to the awareness of the doctor performing the procedure and the pathologist examining the biopsy as to whether or not you'll actually get a diagnosis of endometriosis. Because the doctor can still miss it, and the pathologist cannot recognize it, which is
Absolutely.
Just bananas.
It is. It's completely bananas. So much bananas. And, I, at this point, actually the reason she agreed to approach it from that way is that I'd basically stopped having periods, which was kind of bizarre because up until I got really sick, my weight had been actually, as far as dancing is concerned, I was heavier than a lot of the girls I danced with, but I was very muscular and strong and fit. And within the first 4 or 5 months of this illness, I lost 40 pounds.
Oh, wow.
And I was completely emaciated. And I still have struggled to keep weight on. And that's kind of a separate issue because I ended up having a lot of long-term issues from all of this damage to my body that the, not having a proper diagnosis lent itself to. But so there were a lot of questions about, well, why have you stopped having periods? And, was there any sort of prodromal activity around that? Like, had I had any strange periods and was I sexually active? And I was like, no. And that was one of the things that had come up a lot is that once we decided that maybe it's a reproductive health issue, all the doctors were like, well, you're a young woman and you're probably having like crazy sex. And I'm like, I'm a virgin. I'm like, here I am. I'm like 20 years old. I've never had sex. And you can keep telling me that I'm getting UTIs from sex, but I think that's pretty hard when you're not having sex. So it's like, I really don't think that that's accurate. And so when she actually agreed to do this surgery, the outcome of that was kind of bizarre. And this kind of haunts me, to be perfectly honest, because I got these records as well and I went over it. And I had an endometrioma on my left, well, technically it's on the fallopian tube. It's very strange. On the end of your fallopian tube, you have these little fingery things that are called fimbria. And they sort of, there's a small space like between the fimbria and the ovary. And so my endometrioma, which is a cyst that is basically filled with old blood, it's part of an endometriosis diagnosis usually. They call them chocolate cysts, which is disgusting, and I don't know why they would ever do that, but it does look, I mean, the old blood does tend to, and any girl anywhere who has ever had one of those periods where it's all that old blood and you're like, what the hell is this? That's basically what's inside these cysts. So when they drain them, it kind of does look like chocolate syrup. And I guess they thought that was like fine to say that. I was not amused when she told me this, but it is like part of the lexicon for talking about this stuff. So it was very large. It was actually larger than my ovary, and it had twisted the tube. Mm. Now, the thing is that it was on the left side, and all of my pain and agony was on the right side. And so I was a little suspicious, but I also said, there is such a thing as referred pain, and bodies are weird.
So I hear, although right? Every single time a doctor has told me I'm experiencing referred pain, they've been totally wrong.
Yeah, exactly. So I was dubious at best. And I also thought, okay, well, you must have like taken the cyst out, and she didn't. And this was actually on her part. I'm sure it was the best clinical judgment that she could make at the time. She did not feel like she could remove it without having to take the tube and or the ovary because it was so involved. Mm-hmm. And because I was 20, I hadn't even turned 20 yet. I was 19. She thought that preserving my fertility was a priority without having actually had a conversation with me about that. Right. She also noted and post-operatively, she told me these things, which I didn't necessarily remember, but it was then in my surgical notes, which I had, so I read them. There were lesions, which she took little pictures of, in the cul-de-sac behind my uterus, which is basically like in your lower back.
I didn't realize there was a cul-de-sac back there.
Yeah, and I was like, is that really what it's called? And I had this like image of like a little waspy neighborhood with like all the houses look the same, and I was like, oh my god, what? So it was kind of odd, and I actually that was like the first time in this journey that I went to like JSTOR and I started reading a lot because first of all, I wanted to make sure that wasn't some like cheeky term. Like I was like, is this a real anatomical term or is she just being weird? Like, and it is, it's actually what they call it. And these lesions that she was able to actually see, which I saw the pictures of, so I had a sense of what they looked like. I suspect that, and this of course was many years ago now, but I suspect that there was more that she didn't have the training to recognize. And that she other than telling me they were there, she didn't do anything. They weren't excised. They weren't treated in any way. She just kind of said, okay, that's that.
So did she wind up removing or even biopsying anything?
I don't think she did. Okay. I think that it was based on her visual assessment and the fact that the cyst itself was pretty obvious even for somebody who wasn't necessarily a specialist. Right. I would really prefer to see a specialist, but there are not very many.
Right, and especially not in Maine.
Yeah, it would require a lot of travel. But I think she felt comfortable with that, and then also correlating it to the symptoms that I had. And
Yeah, no, I wasn't asking that to like doubt your diagnosis.
Oh, no,
I
no.
just was curious if she actually did anything while she was in there.
No, actually, she other than well, what she did do was she lanced the cyst and drained it, and then
Oh,
put
okay.
interseed on it. Now, interseed is a surgical mesh, and I don't know if you've ever done any reading on it or if you have experience with it, but quite
I've seen
recently,
all of those late night commercials that are like, if you've had surgical mesh, and then it's like some class action lawsuit that they're recruiting for.
yeah, basically, if I had known that that was the outcome for that particular finding, I would have specifically requested that she not use surgical mesh.
Mm-hmm.
And some surgeons don't. This is actually, I think, really important for anybody who may ever have surgery to know, but I think particularly women who at some point may have to have a gynecological surgery. Some surgeons do not really use surgical mesh, or they use a very specific brand of it. And some do. Some really rely on it. And she was one of those surgeons that it was just part of her routine to use it, and it can cause a lot of problems, and it depends on, I think, a lot of factors for you specifically and histologically, how you form scar tissue and how your body heals. But because I was young and didn't have like a parental advocate, I didn't have a room full of people who were going to question her, I think it was a lot easier for her to just kind of do whatever her routine was, because nobody was going to hold her accountable for it if she screwed something up, except that I eventually kind of did, because I got out of that surgery and nothing was any better. And at that point, I wasn't even sure of what she had told me in terms of a quote unquote diagnosis, because I didn't know what endometriosis meant. I didn't know what the cyst meant. And I asked her at my follow-up, I said, you said you drained the cyst, but you didn't take it out. So is it going to come back? And she was like, probably.
Oh, good.
And
Thanks.
I would, great, thanks. And I told her, I said, I would be willing to have a conversation with you about, the pros and cons of removing it at the risk of also removing the tube, because if it twisted the tube, then isn't my fertility already compromised? Even though that's not a huge concern to me right now, I would think that if the tube is damaged or if it's obstructed, then I already have compromised fertility. So,
Right.
what are we protecting by not doing it? And she didn't like shut down the conversation, but she kind of did that thing where she put her hands up and was like, I don't know. Like, we can talk about it in a few years, or, at least like wait until you're 30 kind of thing. Like,
Let's wait until it comes back.
Yeah. And I was like, I wanted to go back to school. And at this point, I was still holding out hope that I could go back. I'd taken a medical leave of absence for a semester, and I wanted to go back in the spring. And I remember there was a point, probably 6 months later, where I just woke up one day and was, basically it was another day of like sleeping all day and sleeping all night, and days and weeks going by and me not knowing where I was and what I was doing. And I just thought, I'm never going to go back there. I'm never going back to school. I'm not, like, this is my life now, and I have to just devote myself to figuring out what the hell is wrong with me, and hopefully before it kills me, because, I was so sick and I couldn't work, and, I pretty much, like, my friends didn't know what to do with me, and it was a really, like, isolating and terrifying time. And I went through a couple of months where they thought I possibly had, I think it's called germ cell cancer. So it's like an ovarian cancer of a particular kind of cell that's particularly common in young women. So I went through that. They thought maybe I had thyroid cancer. I mean, I went through all of these really terrifying possibilities kind of by myself. Mm-hmm. But the only thing that gave me comfort was trying to educate myself. And so the spring and summer passed, and I realized I wasn't going to go back to school. And then within the first year and a half or so, I was able to get a job in a hospital. Basically what I was doing was I was working in the medical records department of the hospital where I would go to the emergency room. And it made a lot of sense to work there because if I was really sick, I'd just like take the elevator upstairs and go to the emergency room. And the woman who hired me is like, I owe her so much because for the first time I was able to at least have good enough health insurance that I wasn't continuing to pile up the enormous debt that I had basically started to accrue back in the fall of 2010 when I first got sick. But, you know, I was able to maybe have a purpose again in some way. Like, you know, I had the tools there and the resources to look into what was happening. And I would sit in the medical library on my lunch break and, you know, pore over the gynecology textbooks. And I just wanted to understand. And there was a turning point about maybe 2 years into this process where I was in the emergency room and the pain had gotten really, really, it had become, I mean, it had been chronic, but it became more acute. It was, the pain had begun to feel a bit different. It felt to me like sort of the markers that they look for in, like, if you have septicemia. So, you know, I remember I was walking upstairs to the emergency room from my office, and every time my heel hit the floor, the pain would like flare up. And so it felt like peritonitis. And I only learned this from working in a hospital and poring over medical records all day because it was my job.
Thank you for listening to In Sickness and in Health. Check out the companion to this bonus episode, episode 16. You can find more from In Sickness and in Health at insicknesspod.com and on social media at insicknesspod. If you can, please take a few minutes to rate and review us on iTunes. It'll help out the show. And don't forget to be excellent to yourselves and each other.